Hi, I'm Megan Kingsley Gale, and I volunteer as director of the Hospital Handbook Project for acupuncturists and their hospital sponsors or hospital admin. So, the Hospital Handbook Project for acupuncturists is a not for profit community resource project, and we focus on working with acupuncturists in healthcare and hospital based practice settings. So a colleague of mine, Kelly Bird Diamond, she asked me to answer three questions, just to kind of tell you guys a little bit about what I do and how that is relevant to this upcoming conference that I will be speaking at, the Atlantic Symposium in November 2021. So the first question she asked me to answer, she wanted me to answer here is, why did I start the Hospital Handbook Project? So in a nutshell, I'll try to do this quickly. Um, I have worked in hospital-based practice. When I worked at Madigan Army Medical Center, I was the first acupuncturist at the Interdisciplinary Pain Management Clinic. And while I worked there, I worked as, as a licensed acupuncturist at the IPMC, which I loved. And as part of that, I also got assigned to lead all of the Army acupuncturists who are working at IPMCs across the globe. And so I led a group of colleagues to talk about standards and metrics for what our work and what we're doing, both for our profession and then how we work within the IPMC. So my title at the time doing this volunteer work was I was the liaison to the Office of the U.S. Army Surgeon General Pain Management. So we worked on, talking about what are the national standards for acupuncture practice and our degrees and, everything from like, that go into like writing a position description to, how you're credentialed in the system and how you work in the system to in the federal system, we have different ways of tracking metrics, just, like in the civilian system, but it's, applied in a slightly different way because it's own system, right? So we talked about like, well, how are we tracking metrics in the personnel tracking system, which is at the time was DIMRS-I, as well as clinical metrics and clinical outcome metrics and how that fits into the whole model. So I left that job when my husband went back to sea in July, August 2014. And but those lessons I learned then, I wanted to continue having those discussions and talking about that stuff on a professional for the profession. So I said, well, while I was doing that, it would have been really nice to have had a community of acupuncturists also working on the civilian sector that we could just tap into and talk to. But that didn't exist at that time. At least it wasn't, in a way that was easy to just tap into and coordinate. So I went and I talked to NCC AOM and asked them, like, is this, something that we can, have more conversation about? And they did that. And I was part of the NCCM hospital-based practice task force that they did, and there's some publications on that. But I wanted to keep that work going because a lot of the standards and work that we do in hospital and healthcare system-based practice, they ebb and flow and change just like any profession in healthcare. So you have to keep having those conversations. So NCCM said, well, it's not in our mission to do that kind of thing. So, you go ahead and do that, and you can do that on your own. And there's a longer story to this that I can link to in the wherever this is posted. But so I did. And so I think we're now on the 6th year of the Hospital Handbook Project. And it's called the Hospital Handbook Project because it was originally going to be a book that we all write together. But as time went on and the resources that we have and don't have, it turns out that it's really the Hospital Handbook Project is a community. So the important thing is that we connect to each other. So if you have a question, you can come and connect to the community and have a discussion about it. And then ideally, eventually someday we'll have more resources so that we can publish more of these discussions and things. And so that's something we're working on even more into 2022. But at this point in 2021, we do have some of those resources published, and they are available on our website. And sometimes you'll see announcements about that through our newsletter. So that's kind of why I got that's a big part of why I started. It was that resource wasn't available to me when I was in hospital-based practice, and I wish someone had created it. And there's a point when you wish someone else had done it, when you were like, well, I guess it's time for me to step up and start it, you know. And so that's kind of what I've done little by little, and that's what the Hospital Handbook Project is today. It's a community resource, not for profit community resource, and we use a lot of different media, from asynchronous to live synchronous discussion, to keep that conversation going, and we really communicate with each other as professionals. Okay, and then I think the second question she had for me was, oh, what is the vision and mission of the Hospital Handbook Project? So our vision and mission is to be the go-to resource for hospital-based acupuncture work, hospital and healthcare system-based acupuncture work, employment practices, and program standards. So what's unique about what we do, part of that vision, is that we are this professional networking community of acupuncturists and hospital-based and healthcare system-based acupuncturists, program managers of programs like that, so clinicians, program managers, researchers, and more. And then the last question was, what is the biggest problem you're working to solve with your Hospital Handbook Project work? So I think the biggest one issue that the Hospital Handbook Project, well, my work with the Hospital Handbook Project does help with, that I see out there nationally, is that there's a lot of misinformation about acupuncturists in our training. So what the Hospital Handbook Project does is it just helps get that, we're just helping get that information out there. Like, we are professionals, we have a graduate degree, and then here are examples of how we work in these different practice settings, whether it's the emergency department or urgent care or primary care or oncology or a rehab, return to work rehab programs, or children's hospitals. We have acupuncturists in children's hospitals, or at county clinic, FQHC. So all these different practice settings, we do have colleagues working in all of those. And so when we get together and have all the people who are working at FQHCs talk about, like, well, here are our standards, and we can have those discussions, or all of our children's hospital practitioners, I can bring them together and we can have those discussions. And yeah, so it's a great resource for that kind of thing, and try to get the word out that we are professionals. We have a graduate healthcare degree, and then we engage in professional practice discussions and professional practice work, and then we define that more specifically. So I won't get into all those details here. We have more resources on the website, but if you guys have questions, please feel free to reach out through the website and ask your questions, or check out our events and see if that fits some of the questions you have as well. All right, thank you.